Hi, my name is Claudio Pedone. I am a geriatrician and I work at the Fondazione Policlinico Universitario Campus Biomedico in Rome, Italy. Incontinence-associated dermatitis is very common in people with incontinence, and the recent report showed that about 1 out of 2 persons with urinary incontinence has also dermatitis, and all of them report an important impact of this problem on their quality of life. Especially this problem goes on top of discomfort coming from urinary incontinence and further adds to the negative impact on self-esteem and social interactions. Right away, because the most important preventive measure for urinary incontinence-associated dermatitis is an appropriate management of urinary incontinence, so the two things goes along in a parallel way. So the sooner the better, of course. There must be strong attention to the early signs of dermatitis in order to start a skincare that is based on the appropriate products to treat dermatitis. And also there must be a strong attention to the right products to treat incontinence in order to prevent the dermatitis. Well, I think the problem comes from the underestimation of the potential severity of dermatitis, because it's not just an erythema, it can go on to skin breakdown and give very important problems along with infections. So first thing is education. And the second is to try to make them understand that it's not a problem and try to get them over the stigma that goes along with the use of products for urinary incontinence. The most important factor that leads to dermatitis and to skin breakdown is maceration. So to keep skin dry and clean is of the foremost importance. So the speed of the absorbed light in cleaning and drying the skin is really very important, especially in situations where the person may not be able to communicate the episode of urinary incontinence, like in people with cognitive decline. So having an absorbent aid that is very effective in absorbing is very important. Well, most caregivers of this patient are informal caregivers, so they are basically untrained. I think the most important thing is to make them understand that dermatitis is a very important issue, and it's not just something that goes along the using of absorbent pads or incontinence. They need to understand that prevention is fundamental, and that use of right products for prevention is of very great importance. For example, the use of mild cleanser, pH balanced, or the use of barrier products like zinc oxide creams. And when dermatitis is there, it's much better to seek for professional advice than just do yourself solution, because it can become a really serious issue. Well, if there's a visible lesion, it's just too late for prevention. So definitely it is important to start the skincare routine along with the diagnosis of urinary incontinence. When a person is diagnosed with urinary incontinence, attention to skin integrity is the first thing, along with the treatment of urinary incontinence. Well, I think that the healthcare provider has to remember that their patient will not disclose urinary incontinence. So active finding of urinary incontinence is very important and is recommended by all guidelines on the management of urinary incontinence. So think of your patient, think that urinary incontinence may be an issue, and ask. Don't be ashamed, because sometimes it's the very professional that is ashamed to ask. So we must really make an effort to make professionals more aware and more prone to ask for urinary incontinence. prevention of complications starts at the moment of the diagnosis. So making the diagnosis is the first preventive measure for preventing complication. So that's why we must ask and we must be aware of the problem in our patients. The problems arising from dermatitis goes on top of the problems that come from incontinence in and of itself, because the respondents to this survey said that it was an added discomfort. So if we can work on dermatitis, we can at least take away that part of the problem. And it's not just discomfort, it's sometimes real pain. So we can do a lot in this regard for our patients. I think that, yes, raising awareness on potential severity of dermatitis is very important, but also I think that a very important issue is to try and take up the stigma that is related to urinary incontinence, and this will make for people easier to seek advice and put on preventive measures. Definitely. Because a sizable proportion of people with urinary incontinence may have cognitive problems, so they rely on their caregivers. So caregivers must be trained, if possible, in the management of urinary incontinence and in the preventive measures for incontinence-associated dermatitis. I would like to make them know that it's not something that just goes along with urinary incontinence. That is something that can be prevented with the right skincare routine and the right products for incontinence. At the moment of the diagnosis, that's the most important thing to start, along with the diagnosis of urinary incontinence.